which can eventually end up with enough infection, one way or another, that can be fatal, either through to body sepsis or more likely to occlusion of the airway. Occlusion of the airway will do it very fast. Starting with inability to open because of what? TMD, temporomandibular joint disorder, generated by inflammation within the temporomandibular joint. This is not a good sign, not a good thing to happen. It can be fatal. And the third set of consequences is a little sensitive to discuss, but can be fatal. And that is, over my career, treating TMD both surgically and non-surgically, and specifically over the last 14 years, where I've limited my treatment of TMD to the non-surgical variety. I treated TMD for the first 36 years of my career surgically. And as you probably know, 14 years ago, I did some research. I decided that long-term surgical care of this problem is not the ultimate solution. There needed to be a better way, and I discovered a device and protocol that made the inflammation within the temporomandibular joint go away predictably, which was a much better treatment than surgery, and certainly much better than treating the symptoms. You're treating the cause. But in the past 14 years, I have had 3 patients who have sincerely shared with me, either at the beginning or throughout, at different points throughout their examination, consultation, and or treatment, that they had been contemplating suicide because they could not stand going through the rest of their life with the constant pain and symptoms associated with temporomandibular joint disorder, which no one through their experience in years, decades, most of them decades, 10, 20 years of repeated symptoms and repeated attempts for professional help, and no one could help them. And they were contemplating suicide. 3 patients.